Calling the 3:00 hearing for the Committee on Human Services. Present with me is Senator Misalucha, and on Zoom conference, we have Senator Ocasio and Senator Ihara. We also have a member that may Zoom in later on, that is Senator Favela. This meeting is being streamed live on YouTube. In the unlikely event that we have to abruptly end this hearing due to technical difficulties, the committee will reconvene to discuss any outstanding business at the 3:30 February 8, 2022 at conference room 225 and via video conference. And a public notice will be posted on the legislator's website. Witnesses, your audio will be muted and your video disabled until shortly before it is your turn to testify. Each testifier will have 2 minutes to testify. If there's a technical glitch during your time to testify, we may have to move on to the next person due to time constraints. We appreciate your understanding and we remind you that the committee has your written testimony. I'll be reading a list of individuals who submitted written testimony for each measure. We apologize if the closed captioning does not accurately transcribe the names. If you're interested in reviewing the written testimony, please go to the legislator's website. You will find a link on the status page for the measure. If you are able to rest on your written testimony, we urge you to do that. Otherwise, and just highlight what you have written down. Otherwise, assume we have read it. And first one up, first bill is SB 2857 relating to child wellness. Establishes within the Department of Human Services a 5-year child wellness incentive pilot program that pays $50 to a state Medicaid benefit recipient who is a parent to a child. Each time the child completes a well child examination, requires the Department of Human Services to adopt rules and reports to the legislature and makes an appropriation. First up, we have, Judy Moore Peterson of the Department of Human Services, MQD, in support. Please proceed, Ms. Peterson.
Thank you very much. Thank you for this opportunity to testify on behalf of the Department of Human Services. I'm Judy Moore Peterson, the MedQuest Administrator, which is also the Medicaid Director for the state. And we do stand on our written testimony in support of the intent of this bill, as long as it does not displace or reduce the funding for our priorities identified in the executive budget. Thank you for this opportunity, and we're available for questions.
Thank you very much. Next up, we have Lindsay Garcia, HMSA, in support. Please proceed.
Good afternoon, Chair, Vice Chair, and members. My name is Lindsay Garcia on behalf of HMSA. We stand on our testimony and support, offering comments, and are available for any questions. Thank you for the opportunity to testify.
Okay, thank you very much. Okay, we do not have any other registered witnesses. Anybody on Zoom who wishes to testify on 2857? Okay, seeing that, we also have written testimony from Craig Uri, Department of Budget and Finance, with comments. Kona Chong, Hawaii Association of Health Plans, in support. Michael Ching, American Academy of Pediatrics, in support. Marilyn Yamamoto, Hawaii Family Advocacy Team, comments. And Dara Carlin in opposition. Members, any questions of the witnesses? Okay, seeing none, we're going to move on to the next bill. SB 2858 relating to child visitation. Requires a parent unable to exercise their parental visitation rights for a court to award visitation rights to a grandparent. Clarifies procedures for an order awarding reasonable grandparent visitation rights. Specifies that a violation of the terms and conditions of the order is punishable as contempt of court. First up, testifying for the Grandparents Hawaii Rights Campaign in support written testimony. And we have Misty Kuhiana, who registered to testify in support. Please proceed, Misty.
Thank you. Aloha, Chair and Buenaventura and members of the committee. Thank you for the opportunity to testify. I speak for myself and behalf of our committee, Grandparents' Rights Hawaii, and we stand on our written testimony and very strongly support Senate Bill 2858. My story starts back in July 15th when my eldest daughter took her own life due to mental illness and drugs and countless attempts to try and save her. We still lost the battle, and she left behind a daughter, a 3-year-old daughter. Her name was Zaylee Marie. And when Talia passed away, the baby's dad decided to terminate all contact from us, and which was another devastating blow, regardless of mediation and any attempts to contact him. So I hired a lawyer and I went to court, and I was told that I wasn't able to do anything because he denied that. You know, through living in Hawaii, being a native resident and being raised in Hawaii, I feel like our kupunas are a big influence in our lives. And I just wish that it was based on a case by case, because then more grandparents like me would be able to have a bond and make a relationship with our grandchildren, and also maybe relieve the overwhelming number of neglect and abuse cases that we face here in Hawaii. And I realize that's the reason why Department of Human Services may have a problem with this bill. But, you know, according to Child Welfare League of America, grandparents in Hawaii have the primary responsibilities of caring for their grandchildren. And Catholic Charities statistics also say that 6,017 children under 18 live in homes with their grandparents or relatives. I find that that's a big number, and in any way, you know what, I'm sorry. Thank you for your time.
Thank you very much. I don't see anyone else registering to testify on SB 2858. Is there anyone on the line who wishes to testify on SB 2858? Okay. Members, any questions of Ms. Kuhiana? I have a question. Ms. Kuhiana, when you tried to go to court and ask for visitation, what did the judge say as to why you couldn't get any visitation?
Well, he said to me that because the father was the sole living parent, and he wasn't willing to mediate, and he wanted to terminate all contact with me. He said that I was at his whim, was his exact words. But I feel like if we can write the bill to be case by case and individually, I feel like, because there's so many through advocating this, I found out that there's so many grandparents that suffer from this, as well as so many people that didn't know. So when we sign wave and when we hand out flyers and post our events on social media, so many people contact us, and they don't realize that this is going on, because in Hawaii, we hanai, right? We take care. And so a lot of people don't know, but so I didn't know what else to do. And I found that trying to pass the bill would be my only way to have a relationship with my granddaughter. And through this, I feel very passionate about it. And there's so many people I talk to, that's why, that want
Thank
this
you
bill
very
to be
much.
passed.
So hopefully we
Thank
give you
you.
rights when we pass this bill. At least
I really hope so.
listen to
Thank you.
Okay.
Thank you.
Thank you very much. Any other questions? Okay, seeing none, moving on. Jackie, can you put this on for me? It's not attached. Thank you very much. So next up, SB 2878, which is relating to children, expands the original jurisdiction of family court to include proceedings for declaration of emancipation of minors, expands the circumstances under which a minor shall be deemed to be emancipated to include the time when the minor is active in the armed forces and upon issuance of a declaration of emancipation by the family court, specifies the rights of an emancipated minor, allows a minor who has reached the age of 16 to petition the family court for declaration of emancipation, requires the court to take certain actions regarding investigation of petition, appointment of a guardian ad litem and legal counsel, and the findings necessary to grant the petition. Requires the court to order the minor's parents or legal guardian to pay for any services ordered by the court. Okay, first up on SB 2878, we see Department of Human Services comments. I see Daisy Hartsfield. Please.
Yeah, aloha Chair, Vice Chair, and members of the committee. The department has submitted written testimony providing comments, expressing concerns, as well as requesting an amendment, and we'll stand by that testimony, and I'm available for any questions.
Okay, thank you very much.
Thank
Okay,
you.
next up, we have Judith Clark, Hawaii Youth Services in support.
Aloha, Chair, members of the committee. Hawaii Youth Services Network, a statewide coalition of youth serving organizations, is in support of this bill because we do believe that there are circumstances under which it is appropriate for a minor to emancipate from their parents. We would, however, recommend amendments to the bill to ensure that the minor is not seeking emancipation due to duress or coercion by a parent or guardian. In the Hawaii Street Youth Survey, 41% of the youth reported that they were forced to leave home by their parents. And just this week, in the annual report from Residential Youth Services and Empowerment, they reported that 42% of their clients in 2021 had been forced to leave home by family. We would also ask for language in the bill that clearly specifies that the young person can continue to receive educational and other services that are normally intended for minors. For example, mental health services from the Child and Adolescent Mental Health Division. Thank you for this opportunity to testify.
Thank you, Judith. Okay, next up, we have Michael Galoyu Jr. For testifying for Stonewall Caucus for the Democratic Party of Hawaii and support. Please proceed, Mr. Galoyu.
Oh, thank you, Chair. Michael Galoyu Jr. for the Democratic Party, the Stonewall Caucus of the Democratic Party of Hawaii. We thank you for hearing this bill. We stand in full support of it. The reasons that a child may need emancipated because they may have been thrown out of their homes, and without being emancipated, they will not be able to have access to SNAP benefits that their guardians or parents will keep and use if they've been thrown out of the homes. And so we've heard from youth service providers that this is desperately needed. We need to be able to create the avenues for especially our homeless unaccompanied minors to have these avenues to be able to access the resources from DHS without going through a abusive parent or abusive guardian. And those 40% that are being thrown out of their homes, a majority of those are LGBTQIA youth and so we encourage that you pass this bill to make sure that these youth have the access to the benefits that they need to make sure they're able to survive and be healthy, functioning adults. Mahalo.
Thank you very much, Mr. Galoyu. Okay, next up, we don't have anyone else who has registered to testify. Anyone on Zoom wishing to testify on SB 2878? Okay, seeing none. We do have comments from the judiciary of the state of Hawaii and comments, and in support, Youth Action Hui, Leah de los Santos, and Michael Galoyu Sr. in support. Questions, members, for those testifying? Okay, seeing none, we're going to move on. Okay, next up is SB 3235 relating to Safe Places for Youth pilot program. Establishes a Spaces for Youth pilot program within the Department of Human Services, requires the program to collaborate with all state departments that offer services to ensure the well-being of youth in Hawaii, to coordinate the identification of youth who are experiencing homelessness and placement of homeless youth with a shelter for homeless youth. Allows DHS to contract with a nonprofit to provide a shelter for homeless youth, requires DHS to report to the legislature before the regular session of 2025. First up, we have Daisy Hartfield, Department of Human Services, comments. We see Kathy
Sorry.
Beth.
Thank you, Chair. Actually, yes, the director is here. She'll testify.
Okay.
Aloha, Chair,
Director.
Vice Chair. Thank you, members of the committee. Kathy Betts, Director for the Department of Human Services. In regards to SB 3235, we do support the intent, and we provided some comments in our written testimony. Happy to answer any questions. Thank you.
Okay, thank you very much. Next up, we have Scott Morshiga, Governor's Coordinator on Homelessness, comments.
Good afternoon, Chair. Scott Morishiga, Governor's Coordinator on Homelessness and Chair of the Hawaii Interagency Council on Homelessness. I'll stand in my testimony supporting the intent and offering comments. Thank you.
Okay, thank you very much. Next up, we have Ms. Clark, again, for Hawaii Youth Services Network in support.
Aloha, I'm Judith Clark, Executive Director of Hawaii Youth Services Network. We are in strong support of this bill, and we have been involved in the planning for the Safe Spaces for Youth Network since its inception. Excuse me. The network of safe places for youth was first conceived by the young people who attended the Children and Youth Summit at the Capitol several years ago. It was voted the top priority for legislative action 3 years in a row, indicating its importance to Hawaii's youth. Nearly half of Hawaii's juvenile arrests are for status offenses, such as running away from home or being truant from school. They run away or skip school because they have untreated mental health or substance abuse needs. They have experienced abuse, violence, or bullying, or other issues that are not best resolved by a law enforcement approach. Our youth want and need safe places in the community where youth can seek help before they get in trouble with the law. It takes a community to raise a child. The Safe Places for Youth pilot program will facilitate coordination and collaboration by government, nonprofit, and faith-based organizations and caring community members to increase the safety and well-being of our children and youth. It will provide safe environments where adolescents can address such issues as peer pressure, unplanned pregnancy, child abuse and neglect, and substance abuse. It will provide young people with ways to deal with problems before they get into trouble and avoid unnecessary arrests for status offenses. Emergency shelter is a key component, providing safe, appropriate living conditions for youth who cannot safely return home. The 24-hour crisis response system will follow the National Safe Place model, in which community partners such as fire stations and public bus systems are recruited as places where young people can go in an emergency. While much of the resources are already in place, funding is needed to ensure 24-hour crisis response capability and an adequate supply of emergency shelter beds, to conduct outreach so that youth, family, and service providers are aware of the program and know how to use it, to provide training for youth workers and ensure coordination of services among the various providers. Thank you for this opportunity to testify.
Thank you, Ms. Clark. Okay, next up, we have no one else having registered to testify. Anybody else on Zoom land wishing to testify on SB 3235?
Madam Chair, Michael Galoyi Jr. with the Stonewall Caucus.
Okay, please proceed.
I apologize. I don't know how this bill passed my review or our committee. We do support the bill wholeheartedly. We've been hearing in other hearings across throughout the session about sex trafficking for minors, helping protect sex trafficking for minors. If we want to end that, we need to prevent it by making sure we have the safe haven places for children that have been thrown out, run away from abusive parents. And this is a great step to making sure that we have those places for those homeless and unaccompanied minors to go. And so the Stonewall Caucus stands in full support of this bill as we move forward to make it a better place for Hawaii and for our keiki, especially the most vulnerable population we have, our homeless and unaccompanied minors. And the state needs to do more, and this is a great way to start that. Mahalo.
Thank you so much. So Mr. Galoyu, my staff may contact you later on to make sure you're registered for SB 3235, okay?
Will do. Okay.
Okay, so anyone else other than Mr. Galoyu who on Zoom land who wishes to testify in SB 3235? Okay, seeing none, those who have provide written testimony, we have the Office of Public Defender in support. We have Budget and Finance providing comments. We have Youth Action Hui in support and Ann Free in support. Questions, members? Okay, Senator Misalucha, to whom?
To Director Betts.
Director Betts, are you still around or? Oh, she
Okay.
is.
So thank you, Director Betts. I am supportive of the pilot program, but I just wanted to see if we can address a concern raised by the Governor's Coordinator of Homelessness, Scott Murashige. I'm not sure if you had an opportunity to read his written testimony. And in it, he said that he sees the program as more short-term. It's a temporary, albeit stable housing. And he is suggesting instead a potential other vehicle, which is the Ohana Zones pilot program. And so would you kindly address that, if you think that that is sufficient, or do you think that a more concerted effort is necessary, albeit the youth pilot program versus the more broader Ohana Zone?
Sure, thank you, Senator. The department, through its various divisions, Child Welfare, Office of Youth Services, HYCF, and Homeless Program Office, all work very collaboratively with the community to locate short-term shelter space. So we do already operate short-term shelters for youth, specifically homeless youth and youth on the run. I do support longer-term solutions, and I would support Mr. Morishige's support of the Ohana Zone bill and Ohana Zone funding for longer-term shelters for youth. We do recognize that there's an issue in the community. There's a problem that we need to address to support and adequately provide services to youth, whether they are homeless or on the run or being, having been asked to leave their home.
So we're not there yet, Director Betts, but if at some point we need to start making choices as to which one we need to allocate resources to, if you were in my shoes, what would you do?
I would do both, Senator. I think we need to address the short-term shelter and the long-term. We need to, Housing First is a foundational tenet of Scott Morishige's program, as well as Homeless Programs Office and HUD. So I would assume that, we need to stabilize youth first, especially as Mr. Galoyu referred to our trafficking victims. We need to stabilize them in short-term shelter, see what kind of services they need, and then provide a longer lifeline into transitional housing and support services. So I think it's a continuum of care that we need to focus on.
That makes sense. Judith, would you
May
like
I
to comment?
respond to the
Yes,
question?
please. Yes.
I agree that both short-term and long-term resources are necessary. This bill does not obviate the need for long-term out-of-home placement for youth who cannot safely return home. But part of the safe place model is follow-up after the immediate crisis to bring into play the whole array of youth-serving organizations and services to find the ones that can address the needs that led the youth to seek help. So this is not a program that is solely for homeless youth. It is also for youth who may feel that they need to leave home in the middle of the night because their parents are fighting and they're afraid that they will become part of the abuse. It is for young people who are having who are truant from school because they're being bullied on the school campus and need somewhere to turn for help. So I do think that this Safe Spaces for Youth pilot project goes beyond a housing model. Emergency shelter is one essential component, but it is not the only one.
Thank you for the clarification.
Okay. Any other questions? Okay, thank you very much. Moving on. Next up, SB 3236 relating to Medicaid patient care appropriates monies to provide one-time enhancement payments of 15% to each nursing facility caring for Medicaid patients to assist with pandemic-related costs and lost revenue. First up, we have Judy Moore Peterson providing comments for Department of Human Services. Please proceed.
Thank you, members of the committee, Chair, Vice Chair. I'm Judy Moore Peterson, the MedQuest Administrator, and we stand on behalf of the Department of Human Services who stand on our written testimony. We definitely appreciate the intent and we offer comments. Thank you.
Okay, thank you very much. Okay, next up we have J.C. Mikulanek from Queens Health Systems and support. I don't see J.C.
Oh, good afternoon, Senator, Chair, Vice Chair. My name is John Garibaldi with Queens Health Systems. We're going to stand in on our written testimony in support.
Thank you very much.
Thank you.
Okay, next up, I see Hilton Raytho of Healthcare Association of Hawaii in support. Please proceed.
Good afternoon, Chair, Vice Chair, and members of the committee. My name is Hilton Raytho, and I'm President and CEO of the Healthcare Association of Hawaii. And thank you for the opportunity to testify in strong support of Senate Bill 3236, this measure would provide critical funds for the state's nursing homes through a one-time enhanced Medicaid payment, similar to what was instituted in most other states during the pandemic. Pandemic has been very challenging for healthcare providers for a number of reasons, including increased costs for labor, supplies, screening, testing, PPE, and other factors. The cost of labor for nursing facilities is approximately 60% of their total costs, and the costs of healthcare workers have been increasing for a variety of reasons. Hawaii started the pandemic with a shortage of nurses and other clinical staff, and the demand for frontline healthcare workers has increased during the pandemic. Our nursing facilities have had to increase salaries to try and remain somewhat competitive with hospitals who have their own staffing challenges. Many facilities have had to turn to agency personnel to ensure adequate staffing for their residents, further increasing their labor costs. The entire pandemic, but especially the Delta and Omicron surges, have severely stressed the finances and staffing in the state's nursing facilities, which is why we're coming to the state for some limited relief. We're proud of what the nursing facilities have done during the pandemic. They lead the nation in vaccinating staff and residents, including having some of the highest rates of boosted residents in the nation. We also have some of the lowest infection and death rate in the nation in the nursing homes during the entire duration of the pandemic, which shows the incredible commitment and perseverance our members and staff have in protecting these vulnerable residents. We understand there are many competing priorities for funding. We are working on a number of long-term solutions to address staffing shortages in our hospitals and nursing homes. And we are requesting support for our nursing homes that would provide meaningful relief and that would demonstrate that they have not been forgotten during these very challenging times. Thank you for your consideration.
Okay, thank you, Hilton. The next up who testified via Zoom is Jake Moore in comments. Please proceed,
Hey,
Mr. Moore.
Good afternoon, Chair, Vice Chair, and members. I'm a nurse practitioner who provides primary care to homebound frail elderly in the community, and I've been doing so for the past 18 years in Hawaii. Many of my patients are dually eligible seniors with Medicare, Medicaid who reside in community care foster family homes. These are nursing home level patients. I stand on my pre-submitted written testimony that we should include these foster home providers in any planned Medicaid payment legislation. I'm available for questions, and I thank you for this opportunity to testify.
Okay, thank you very much, Mr. Moore. Okay, next up, no one else having registered to testify via Zoom. Is there anyone online who wishes to testify on SB 3236? Seeing none, members, any questions?
I have a question.
Okay, Senator Misalucha, please proceed.
Hilton,
Hilton, are you on?
Yes.
help me understand, Hilton. So the bill as it stands is for 15% of Medicaid payments, but I'm reading from your testimony that you're hoping to put forth majority of this payments and apply it towards labor costs. Is that what I'm assuming is what you're saying?
The labor costs are one of the most significant portions of costs for our nursing homes, but the money and what we're asking for is approximately 15 million from the state general funds, and there would be a federal match. The total would be approximately 25 million. And so this is a one-time payment for the next fiscal year, and it would be paid through Department of Health only to the nursing homes that provide service to Medicaid members. So if you have nursing homes that are private paid, they would not be the recipients of any of these funds. And as I mentioned in the testimony, the nursing homes have had material increased costs during the pandemic. We have been able to secure federal funding, FEMA funding for our hospitals to bring in to help offset some of their labor costs, but we've not been successful in getting that funding for our nursing homes. And so we are looking for some relief for our nursing homes who have had incredible challenges. And the money would be, if we are able to get the money, we would be used to our nursing homes. How they use it, whether they use it to, they could use it as sort of as they see fit. But the labor costs are one of the most significant costs that they have incurred for the entire duration of the pandemic and continue to incur.
I certainly don't begrudge the nursing facilities from determining and discerning to that extent as to how to pay it. But is there a way that those monies trickle down to the nurses, the folks who are actually working to alleviate the pain of those who are suffering during this pandemic? And I guess I say that, and again, labor would be where you're hoping to recruit more people, but at the end of the day, is there any way that the actual care providers will be given a little bit of those monies?
There are part of the challenge, and one of the reasons we have made this request is because labor costs have gone up. To give you a specific example, CNAs, which is a significant portion of the labor force in our long-term care facilities, they have been making roughly, $15 to $16 an hour. However, because of the demand and because of some of the union negotiations, the going rate for CNAs in many of our institutions now has gone up for $20 to $22. And so that is part of the challenge, is that the long-term care facilities are paying more money, which is good for the CNAs. They're getting more money. That's great. The problem is that they've not gotten an increase in the reimbursement to help offset those costs. So the labor costs again. So does this have this money would help pay for those salaries and would help to pay for those staff who are already in our facilities, as well as help ensure we're working on a number of initiatives to attract more people into our nursing homes, working with our community colleges, our high schools, working with all of our universities to increase our labor pool. And this money would be very, very instrumental in helping to both attract and retain healthcare workers and pay them the money that they do deserve to get.
Just one quick one. What do you think of, Hilton, What do you think of the idea of including foster homes that was just raised?
Yeah, we're very open to working with the Department of Human Services on that. We are talking, and we have talked to Department of Human Services MedQuest agency about the mechanism for making this payment. So very happy to have that discussion with the Department of Human Services.
All right, thank you, Hilton. Thank you, Chair.
Thank you. So any other questions from members? Because I have a number. Okay, so first up. Okay, so Hilton, 2020, you folks got a lot of federal monies for skilled nursing facilities, $50,000 plus $2,500 per bed. Did you folks run out of those monies? And is that the reason why you guys want more money now?
That federal money was very, very much appreciated, and it has been well used. The healthcare, as you know, is very expensive anywhere, especially in Hawaii with the cost of land, the cost of electricity, the cost of supplies, services. So this is primarily designed to help defray that gap between the what Medicare pays for services and costs. And generally, not in every case, but in many cases, Medicaid pays below cost. And so, and that is, and costs have increased, as we've just talked about. Labor costs have gone up materially. We've had to, nursing homes have had to do much more testing, or, you know, the testing cost, normally they don't do all the testing because, you know, you're not in a pandemic. So testing costs have gone up. They're having to do screenings. They've had to rearrange, make structural changes to their facilities to accommodate visitors and take care of the residents. So the money which has been received from the federal government was very, very well received, but it is only a small portion of the total costs that our members have incurred as a result of the pandemic.
Okay. No, because basically when I read your knowing that you folks received all that CARES money in 2020 and reading your report, reading your written testimony, I came to the same conclusion that Senator Misalucha said, was that a lot of these monies are to pay for increased labor. So I'm hoping that, yeah, the bottom line workers will end up getting it. So so thank you. Judy Moore Peterson, are you still around?
Yes,
No?
yes, I am.
Thank
I'm
you.
here. I'm here.
Okay.
Yeah.
Okay, so you know that since 2020 and in fact there was an informational briefing back when I was House Chair of Human Services. I was always concerned about the CCFF, the Community Care Foster Family, and the Arches, the one that Jake Moore was testifying to, because they don't get the CARES monies that went for the nursing facilities. Yeah, and we'll do. This is going to go on to WAM. For the CCFF, the foster fit, you know, the small care facilities, E-arches, will you be able to calculate a 15% at least one-time payment for them?
Yes.
Before the next committee.
We are, if you're interested in that, we are happy to do that calculation. I will also note that as part of the American Rescue Plan, we're also given an opportunity to increase payments. And we are in the process of doing that through the home and community-based services. And we actually have a budget ask for that as well. At that point, right now, that's on average only a 5% increase, but we are happy to take a look at a larger increase because we agree that they definitely deserve they're facing some of the same cost increases, et cetera. And so we're happy to provide that information to you.
Okay, thank you very much. And I do have one question. Jake Moore, are you still around? Hi, so you heard my questions. Did you receive any, did the CCF, the Community Care Foster Homes and the E-arches, Did they receive any of the ARPA $2,500 per bed type relief back in 2020?
Through their associations, their membership associations, I honestly don't know the detail. I know they got some support for PPE and different things, but I don't know what funds they actually got.
Okay, so the PPE is another set of monies that we.
I don't know the details as to what.
10 million for. Yeah. Okay, but okay. So you folks are open to a 15% one-time payment like the nursing facilities have testified to. For you folks too, right?
Anything is good, yes. They're
Okay,
taking care of the same patients.
Yes, thank you very much.
Thank
So
you.
any other questions, members, based upon the questions I've asked? Okay, thank you very much. We're gonna move on. So next up, SB 3237 relating to child welfare services expands the investigative authority of the Department of Human Services to include foster children with a pending adoption decree, foster children where an adoption decree has been issued but adoption has not yet taken place, children who are placed into legal guardianship and who receive permanency assistance payments, and adopted children who receive adoption assistance payments. Establishes a crisis mobile outreach team pilot program to expand existing crisis response services, and requires the Department of Human Services to analyze and report on the impact of expanding home visits to families receiving adoption assistance or legal guardianship assistance, and medical report to the legislature 5 years after the program. So, folks, this appears to be a response to the Isabella Kaluna case and other adopted foster children who are in the same position. So first up, SB 3237. Hawaii State Department of Health in support.
Good afternoon, Chair, Vice Chair, and Committee. I'm Dr. Janelle Hernandez Armstrong from the Department of Health, and I appreciate the opportunity to testify in support of SB 3237. As a clinical lead and now the chief psychologist for the Child and Adolescent Mental Health Division of the Department of Health, I've worked to improve mental health crisis services at the behest of emergency department physicians seeking help for youth who've been in the ER for days without access to appropriate mental health treatment, police officers, parents, foster parents, child welfare workers, and many others seeking support for youth in crisis. I have worked with these community partners and others to improve communication and provide resources to youth and families. Despite these efforts, we continue to see youth in emergency departments for days or weeks without proper mental health care, foster families and parents and other caregivers struggling to keep high needs youth in their home, and suicidal and severely mentally ill youth struggling to lead a happy, healthy life. This bill would provide needed support to traumatized and high needs adopted youth and youth in legal guardianship by ensuring better oversight and therefore opportunities to support struggling youth and families. Additionally, this bill would provide much needed support to youth and families in crisis by offering short-term follow-up care to youth and families seeking crisis support. Similar programs in other states have proven to reduce rates of out-of-home placement and use of high-level resources such as emergency departments and residential treatments, thus reducing costs to the state and improving outcomes for youth. It is CAMD's vision to have happy and healthy children and families living in caring communities. Please pass this bill to help this vision become a reality. I'm available for questions. Thank you.
Okay, thank you very much. Next up, we have the Deputy Attorney General, Lynn Newman, with comments, or whoever's testifying for Attorney General. So.
Yeah, good afternoon, Senators. James Walther for the Department of the Attorney General. We support the intent of this bill and have provided some comments to address some potential legal challenges, and have also provided some suggested revisions to address those challenges. I think yes. I'll just be available for questions. Thank you.
Okay, thank you very much. Okay, next up we have Daisy Hartsfield, Department of Human Services, providing comments.
Aloha, Chair, Vice Chair, and committee members. This is Daisy Hartsfield, Social Services Division Administrator for the Department of Human Services. The department did submit testimony which we will stand by. I do have just two additional comments. One is that the department welcomes additional funding as well as positions. And secondly, I need to recognize that most of our resource caregivers are trustworthy and nurturing caregivers, but we do understand the intent of this bill, and I'm available for any questions. Mahalo.
Okay, thank you very much. Okay, next up we have Nonohe Botello in support. Unmute yourself. Thank you.
You have me, okay. Aloha, do you hear me?
Yes, got it.
Aloha, my name is Nonohe Botello. I'm an independent consultant for victims and their surviving families of homicide. I am also representing Ariel Sellers, AKA Isabella Kalua, and her family. I am in support of the intent of this bill. Of course, we need more funding and more services to reach out to these specific children who are in crisis. I just had a concern about monitoring to make sure that the crisis team is actually addressing the very kids like Ariel Sellers, and that the services are getting to them. I would like to see that the carved out money specifically for monitoring and tracking the responses to these kids. Because in Ariel Sellers' case, that was the problem. There was lack of monitoring and it cost Ariel her life. And so we as a community and as an advocate, I want to know how this is going to be monitored and make sure that the right protocol is being followed when reaching out to families like Ariel Sellers. Thank you for your time.
Thank you very much, Ms. Botello. Next up, we have Jenna Lynn Oda in support.
Hello, Madam Chairperson, Madam Vice Chair, committee members. I appreciate and mahalo piha for this time to speak about this bill. I am a current foster parent. I have been doing it for 7 years. I have adopted as well. Anyone is welcome into my home. Again, I receive subsidies because I do legal guardianship as well. A few points that I like to mention is the minimum time that I have to keep a child in order to adopt or legal guardianship is 6 months. Within that time, until they're 18, things can happen. We've had instances where children have tried to stab their new adopted parents, and there's no resources for them to reach out to because why they've already been adopted out. This program that is being initiated would help that. Even for myself, I take pride in all the children that I have, but a lot of them have special needs. So for me, I'm a proactive parent. I'll ask questions, I'll call whoever. Some people don't have that and they'd like to have more resources at their fingertips. And if somebody could at least come in every, once a year to check up and see if everything is going good, if they need anything, this bill would actually help that. On top of, we have a pandemic going on. So a lot of kids are now homeschooled. So we don't have that opportunity where they can go to a teacher and say, hey, something's happening to me. So this would help that as well. I again appreciate you all. I thank you for all your hard work and the time.
Thank you very much, Ms. Oda, for your work. Okay, next up we have Lisa Otis in support. Please proceed.
Hi, I'm Lisa Otis. I support Bill 3237. I am testifying today with an angel on my shoulders, Ariel Sellers, formerly known as Isabella Kalua. This innocent girl could have been saved if measures like this were in place last year. Instead, of behalf of Ariel, I would like to make sure that no other child goes overlooked. I want to thank the multi-agency task force that keeps kids safe and helps them heal. I worked with children for 19 years, including working at the Friends of the Children's Justice Center of Oahu. It's sad how many children I've seen from sex abuse, physical abuse, neglect, witnesses of crimes, yet so many more go unreported. It takes a village to report abuse, especially with remote learning. And according to the DHS APSR, every year there are thousands and thousands of child maltreatment reports. I understand CWS is short-staffed, and a crisis mobile outreach team will have the authority to intervene, and that's how we can save kids from further abuse if it's monitored. Funding and hiring more CWS workers will help to ensure that more innocent children don't fall between the cracks behind closed doors. I trust and know that there are a lot of social workers out there with big hearts to continue the job at hand. Ariel's life has really touched the community of Waimanalo and beyond, and so has the lives of Peter Boy, Shaylin, Cyrus, Grayson, Kitana, Fabian, and countless other innocent children. Before we lose another keiki, let's please adopt these laws. Let's get more eyes on our kids by appropriating more assistance and funding for these CWS workers. Mahalo.
Okay, thank you very much, Ms. Otis. Okay, next up, we have Kapua Medeiros in support. Please proceed.
Aloha, Chair and members of the committee. I am in support of both House Bill 2424 as well as Senate Bill 3237, as it would allow for the appropriation of funding for increased staff training and support, as well as increased in-person site home visits and added monitoring systems put in place for the child welfare system. All of these are very necessary in the prevention of any more criminal acts of abuse towards a child such as Ariel Sellers. Her senseless tragedy could have been avoided. I believe it is the state of Hawaii's responsibility to ensure that all policies, procedures, training, staffing, support services, as well as funding are in place to support the child welfare system. I also believe it is the state's responsibility to monitor the practices, the status of and outcomes of the child welfare system, as well as the status of progress and welfare of each and every child within that system. And until such time that they're of legal age and able to provide for their own welfare, I hope that that will remain. I would also recommend that this committee take into consideration that there will be put in place an external entity to also monitor the welfare of each child within the child welfare system. Lastly, although my testimony is to provide, although my testimony is to provide my own mana'o on these measures, I would like to add that as a member of the Waimanalo Neighborhood Board, I am proud to know that our community takes this matter serious enough to spend countless hours to create an action plan as well as resolutions to ensure that the name of Ariel Sellers is never forgotten in our community, and to prevent this very sad and senseless tragedy from ever happening to another one of our precious Waimanalo keiki. Mahalo for your time and efforts to support and pass both House Bill 2424 and Senate Bill 3237. Mekelo Hanui. Mahalo.
Thank you. Okay, next up, Kiminoa Kane in support.
Ano ai Mekeloha, Ubano Kimiona Kane, no Waimanalo Mayao. Aloha Chair, members of the committee and general public. I'm here to testify on behalf of Senate Bill 3237 in support, both as an individual resident of Waimanalo and also as the chair of the Waimanalo Neighborhood Board. As already stated, our community is still dealing with this tragedy, as many communities are. And, you know, we found that it is very important to address the mechanisms that are missing currently from this process. And so without further ado, Chair, I just want to make sure that we stand on a written statement as a neighborhood board, and then as an individual, we really highly encourage that we continue to push for these efforts to measure the safety of our keiki even firmer than it is currently, because we cannot continue to lose keiki through the gaps. And you know, certainly we are dealing with this continually as you folks now have that kuleana to Owamo to take on. We continue to stand by the need to protect our keiki and our future here in Hawaii, because Ariel's case should not have happened, and it's a tragedy that we're all dealing with. So I'll stand on my written comments on that as well, Chair, and I mahalo you folks for your time and service. Thank you.
Thank you very much. Okay, nobody else having registered to testify on SB 3237. Is there anyone online who wishes to testify on SB 3237? Okay, seeing none. Members, any questions? Okay, Senator Misalucha.
Director Betts, please.
I apologize, Senator. She's no longer available,
Okay,
but I
sure.
can answer. I can try to answer
Sure.
whatever questions you have.
Yeah, so in reading the testimony from the Department of Human Services, it appears that you do support the intent of the bill and are mindful of the fact that, you know, there are situations or I guess situations that need to be curtailed, particularly in this case, the Isabella case. But at the same time, you did raise a lot of concerns about the bill itself, and instead, you're actually asking that it be considered that the school-based family resource center which is a 5-year pilot. Do you know what I'm talking about? Be considered instead. So I'm kind of curious, that pilot though, and it's a 5-year, isn't that a little too late and too slow? Because we need something right now, right? We need something that would show to the community that we are doing something, that particular situation with Isabella is not acceptable. That whether it be, you know, more frequent visitations, all the other things that are prescribed in this bill, but you feel that because of your, you know, lack of resources, I think is what I'm reading it here, that you may not be able to comply with the provisions of the bill. So I'm curious whether the 5-year, what you're suggesting, which is the 5-year pilot, and I think there's a administration measure that you're trying to push forth, which is SB 311 and HB 2148, which is a companion bill. And so you're pushing for a standard family resource model. And in fact, you had shown that studies have shown reports that if that is in place, child welfare have decreased. Would you be able to address that?
I'll try, Senator. Thank you for that opportunity. First of all, I need to clarify that I can't speak specifically in regards to a specific case. I'm going to speak in terms of general.
I understand. Yeah, but I guess everybody has been alluding to it and making reference to it, so I'm just sharing that as well.
Right. So generally, Child Welfare Services continue to assess its practices and policies. So in our testimony, we did include some of the things we're doing to address some of the concerns that are addressed in this bill. And when we talk about the proposed Family Resource Center, we believe that this is going to be another service that can enhance the monitoring. We rely a lot on the public to report cases of alleged child abuse and neglect, because that's how we enter, that's how we can conduct our investigations and enter families' homes to see whether or not there is a valid concern regarding a child's safety. We also recognize that we need enhanced services to increase the number of eyes on a family. And this family resource model is one of those services that we believe could be helpful, because it would allow a less threatening type of situation for families to seek help. We've discovered that there is a stigma when families do receive services offered by CWS, and despite our efforts to educate people and to encourage them to seek services, because of some of the public opinion, as well as, like I said, that negative stigma attached to child welfare being involved in a family's life, there's been some hesitancy in seeking out help. And so it's our belief that this type of service, the Family Resource Center, would be a soft way for them to reach out and to get that type of enhanced services. And hopefully that will be a mechanism for them to receive services so that we can avoid situations that escalate to the point where a child is harmed. So I hope that answered your question.
Yeah, I think to a certain extent, I'm still wondering if this bill goes through, it'll be the Department of Human Services who will be the implementer. And if you're not really 100% rallying behind it, it might be difficult. So I guess at some point, even if it moves, it goes on to the next committee. Somehow you guys need to figure out how to make it work.
Right. If we can overcome some of the constitutional issues that the Attorney General's office raised as well, that will help. And so we are having discussions with our lawmakers to try and see how we can continue to improve the system. So we're open to discussions.
Yeah, I think the community though is looking for leadership, looking for concrete, specific steps that would ensure that, what happened to Isabella, and again, I'm referring that in a very broad way, not necessarily specific to the case, will not happen again. Thank you so much.
You're welcome. If I could just make one last comment, I believe that this has provided an opportunity for us to educate the community. We've participated in more community meetings. And I think the fact that we're just having these discussions is helping for the public to better understand the work that is done and the things that are done to protect our children. So I do think this is a good opportunity for people to become more informed about what CWS can and cannot do. So I thank you for that.
Thank you, Chair.
Thank you. And I see Senator Ocasio has a question. Please proceed.
Yeah, this is for Department of Human Services. So, I mean, obviously this is very complicated. But my question is, in what ways can Department of Human Services ensure that families aren't to blame and children aren't taken away from their families if the real reason is actually structural poverty? And so just part of that bigger conversation and that you're alluding to, that of course it's wonderful to be having, and also in a public forum is really important. So like is the neglect the parents' fault? Is it, or is it a manifestation of this larger poverty crisis that we face here in Hawaii? And then I think it is important to raise the question that about, that does come up, excessive and unnecessary, potentially unnecessary removals from homes is perhaps part of the caseload overload. I know there's much more, so I'm not trying to minimize it as one issue, but
before Ms. Hartfield answers that, I just want to and I understand Senator Ocasio, your freshman senator, as well as Senator Misalucha, but we are moving towards a family first model where the idea is to require retention as a policy rather than removal. Okay, and Daisy Hartsfield knows that I've been pushing for them to get their act together to start implementing this whole family first model, which has been required by the federal government for a couple of years now. So knowing that, Ms. Hartsfield, why don't we talk a little bit, because that is not really the question we have here. I mean, that's not the issue we have here, but I guess a status report on the family first before we have any other questions that is related to specifically on this bill. Yeah.
Sure.
Would it be okay if I made a quick comment on this after Ms. Hartfield?
Okay, yeah. Wait a second. Let Ms. Hartsfield talk, and then we can talk. We can call you, Ms. Armstrong.
Right. So factors that lead to child abuse and neglect are great. It varies. It really, specific facts pertain to specific families, and what applies to one family may not apply to another. So it's all of the above as to causes of child abuse and neglect. And we recognize that in terms of our families here in Hawaii, as well as nationwide, if we can provide support to maintain a child in the family home, to strengthen the family, that actually is in the child's best interest. And so we submitted our Family First Hawaii plan to our governing body, which is the the Administration for Child and Families, which is part of the federal government. And our plan was one of the first in our region. We're in Region 9 to be approved. So we have a 5-year plan that has been approved. We started implementing preventive services in October. We've staggered implementation to provide these evidence-based services so that we can maintain a child in their family home while providing supportive services to these families to avoid having to place the child into foster care. So this is a shift in terms of child welfare services. And so we're hoping that we can maintain more children in the home. At the same time, though, we have recognized that for our children who are adopted or where there is legal guardianship, we hear the voices of our resource caregivers and they need more support. And so one of our contracts in terms of trying to recruit resource caregivers, we modified it. And so we included additional things such as support services, additional training, so that our recruitment of resource caregivers, we can recruit better qualified individuals. We can provide them support services. And then we also have a post-permanency strengthening services program that is offered. So we're listening. We hear what the public is saying.
Yeah, thank you. And Senator Ocasio offline and Senator Misalucha, I can give you the history of a lot of it is federal funding, right? Okay. Federal funding has told us to go one certain way, and hopefully the shift towards retention will help us move forward. And Ms. Hernandez, normally we are done with testimony, but if you could keep it short, because we do have a hard stop at 4:30 and we still have a couple of other bills, and otherwise we cannot pass any bills.
Yes, I'll be brief.
By 4:30. So
I'll be brief.
Really fast.
Thank you for the opportunity. I just wanted, thank you for the question, Senator Ocasio. I just wanted to draw attention to the pilot project in the latter half of this bill that is meant to address those issues so that when families are struggling, they can reach out and get crisis support so that they are able to retain youth in their home. So I just wanted to draw attention to the latter half of the bill with the pilot project.
Okay, thank you very much. Okay, any other questions regarding this bill? Anything about history we can talk offline? Okay, thank you very much.
Thank you.
Okay, oh, I just want to make sure the record reflects that for 3237, we also have testimony from Budget of Finance providing comments on the ESSER funding, Waimanalo Neighborhood Board in support, written opposition from Hawaii Family Advocacy Team, Marilyn Yamamoto, in support, Kim Kaua, Cindy Evans in support, and we also have Sandy Moniz-Pa in support, Lori Tochiki in support, Juanani Rogers in support, Deborah Goodwin in support, and in opposition, we have Dara Carlin and Julie Tinsman in opposition. And no one else having provided written testimony. Okay, so we're gonna move on to SB 3323, which is, let me read it. Okay, relating to attachment, increases the amount of the exemption from attachment or execution of real property in a motor vehicle. Exempts 1 month of child support and spousal support from attachment or execution. Okay, first up, we have, oh, we don't have anybody in Zoom, but we have written testimony from Health and Harm Reduction Center in support, Paul Norman, Neighborhood Place of Puna in support, Habitat for Humanity in support, Hawaii Debt Solutions in support, Barbara Franklin, Attorney at Law in support, Hope Services of Hawaii in support. In opposition, we have Hawaii Financial Services, Mortgage Bankers of Hawaii in opposition, Hawaii Credit Union League in opposition, Bill Plum Collections Law Section in opposition, and Mary Ebersole in support. And anyone on Zoom wishing to testify on SB 3323? And members, we don't have any live witnesses to ask questions of. So breakout room, please. Recalling Committee on Human Services 3 o'clock calendar for decision-making on SB 2857. Chair's recommendation is to pass with amendments. We are going to insert $4,516,000, the blank appropriation. We're going to add a defect date because to see whether or not any of the ESSER funds per BNF's concerns are going to be met. We're also going to add in the committee report, but not in the bill, HMSA's concerns that the DHS rules to be adopted to implement the child wellness program include children in CHIP and the well child examination, requiring the provider to submit a completed early and periodic screening, diagnostic, and treatment. Any questions, concerns? Seeing none, Vice Chair for the vote, Chair votes aye.
Okay, we're voting, the Committee on Human Services will be voting a number of bills. The first one up is Senate Bill 2857 to pass with amendments. Chair San Buenaventura.
Aye.
Aye. Senator Har votes aye. Senator Ocasio.
Aye.
Senator Misalucha.
Aye.
Senator Favela is excused, I believe. Okay, the recommendation is adopted.
Okay, thank you. Moving on, SB 2858 relating to child visitation. Chair's recommendation is to pass with amendments. We are going to accept the SMA recommendations and otherwise make tech amendments. Other than that, any questions, comments? Seeing none, Vice Chair for the vote, Chair votes aye.
For the members present, any reservations or objections to the chair's recommendation? The recommendation is adopted.
Okay, so for SB 2878, Chair's recommendation is to pass with a lot of amendments. We're going to accept the Department of Human Services amendment to delete on page 10, lines 3 to 8, and accept the judiciary's comments. So on page 7, every reference to shall will be made. And on page 7, line 14, after the word by, we will insert a DHS recognized youth service organization on behalf of the minor. And before the word minor, insert an attorney or minor. They're all there. On page 9, we're going to delete section 4. We're going to remove page 5, line 3. Page 10, we're going to delete section 8 and section 6. Page 10, line 20, we're going to insert nor prevent the petitioning minor from continuing any existing educational and other mental health services that the petitioning minor receives solely due to the minor's age. So accept the Youth Action Network's concerns. On page 12, on insert 8, emancipation is not sought due to duress or coercion by a parent or guardian. And on page 12, line 4, delete the word number 8 and insert the word the number 9, and other technical amendments for the purposes of clarity and consistency. Any questions? Okay, seeing none, Vice Chair for the vote.
Members, we're voting on recommendation to pass Senate Bill 2878 with amendments. Any objections or reservations for the members present? Hearing none, the recommendation is adopted.
Okay, so for SB 3235, Safe Places for Youth Pilot Program, or did I say that already? Okay, basically, we are going, Chair's recommendation is to pass as is. Any questions, concerns? Seeing none, Vice Chair for the vote.
Any reservations or objections to the recommendation to adopt Senate Bill 3235 unamended?
That's
The
correct.
recommendations adopted.
Okay, for SB 3236, Chair's recommendation is to respond to SMA's concerns regarding the 15%, to clarify that it's 15% of Medicaid patient payments as of the next fiscal year, blank out the appropriation amount, and for every reference to nursing facility, to amend that to nursing facility, comma, community care, foster family homes, and expanded adult residential care homes. And in the committee report, request Department of Human Services to also consider expanding it to all HHSC members per HHSC's written testimony. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
For the four Committee on Human Services members present, we're voting on the recommendation to pass Senate Bill 3236 with amendments. Any objections or reservations? Hearing none, the recommendation is adopted.
Okay, for SB 3237, we are going to remove lines 12 to 16 on page 1, on page 3, lines 10 to 14, accept the Attorney General's amendments and SMA's recommendations, and hope that would be enough to satisfy the Attorney General, because it's a needed measure.
Chair.
Any questions, comments? Yes.
Chair, this is Yuko from SMA. I believe you and the members considered defecting the date for this one during executive
Yes.
session.
Yes, so you're right, and add a defect date.
Thank you.
Thank you, to ensure that we have fixed all of the problems with the bill. Thank you. So Vice Chair for the vote, pass with amendments.
Okay, we're voting on the recommendation to pass Senate Bill 3237 with amendments. Any objections or reservations for the members present? The recommendation is adopted.
Okay, thank you very much. For SB 3323, Chair's recommendation is to pass with amendments. We're going to amend on page 3, line 17, after the number 100,000, add inequity in one property and the SMA recommendations. Any comments, questions, concerns? Seeing none, Vice Chair for the vote.
We're voting on the chair's recommendation to pass Senate Bill 3323 with amendments. Any objections or reservations? The recommendation is adopted.
Okay, thank you. We are adjourned.